Is Furman Fordham, and I am the senior pastor of the Riverside Chapel Seventh-day Adventist Church here in Nashville, Tennessee. And we are bringing this live broadcast so that we can deal with the topic of the coronavirus, COVID-19, so that we can educate our community. We have a ministry here at Riverside that we call Next Steps, and it is our adult enrichment program where we provide various educational classes for adults, enrichment classes. And because the main issue right now in our community is this virus, we thought it appropriate to bring in some professionals from our community who might be able to help us give insight and education to individuals regarding how to respond to this pandemic. So I have with me Dr. Darlene Jenkins. She is a doctor of public health who currently works as the Senior Director of Programs for the National Healthcare for the Homeless Council. Welcome, Darlene. So glad to have you. And we also have with us Wycliffe Wright, MD, who is a practicing physician in internal medicine, infectious diseases, and a physician advisor. Dr. Wycliffe, happy to have you. We have a variety of questions that we're going to ask both of these individuals for our first segment, which will be dealing with health information. Then we'll have a second section with some other professionals, which will deal with how to support our young people educationally while they're at home. To start us off, I'm going to ask this first question of you, Dr. Wright. Why is this disease being called coronavirus 2019 or COVID-19? What is the whole rationale for the name of this disease?
Thank you very much, Pastor, for having me on this occasion. There is a need to be able to identify any disease process we have so that anyone around the world who is talking about that disease knows we're talking about the same thing. And there's a convention between the World Health Organization and the World Organization for Animal Health, as well as the Food and Agricultural Organization, that determines how diseases are named. That's in place. It's not something that just came about because of COVID. And so they named this germ based on this disease based on the organism or pathogen that causes it, as well as the year that the disease is recognized or first comes about. So COVID, CO is for the coronavirus, corona, VI is for virus, and D is for disease, COVID. And 2019 because the disease was first identified in 2019.
Okay, I appreciate that. So it's not just grabbed at random. It actually has some rhyme and reason to it. Could you also share, if we know, what the source of the disease is, or the source of the virus?
So that's an interesting question because initially people were thinking that this coronavirus, which is a variant from coronaviruses that we have had in the past, initially started in China and was related to bats. That was the initial thinking. This coronavirus can live in cattle, can live in cats, can live in camels and bats. But there's an animal called pangolin, Pangolin, which is a delicacy for meat in China and some other of those countries. And this germ is thought to be highly associated with this animal. So when they look at the homology or sequencing the DNA of this coronavirus 2019 and the coronavirus found in that animal, they are almost identical, more so than the one found in bats. So it's thought that this germ actually is probably from exposure to that animal. Now, how would the germ get from the animal to humans? Occasionally, we can have a situation where a germ jumps from an animal to a person whether it's by direct contact or by eating. We're not sure what happened here. And then that germ can then go from person to person. In this particular case, we have also what's called community spread. And in community spread, people don't know how they're exposed. When they were exposed, they just come down with the infection. And 4 out of 5 people give that as the explanation. I don't know where I was, I don't know who I got encountered with, but I'm here with the illness.
Yeah, I understand. Well, let me ask you this, if you could help us, Dr. Jenkins. So how would I know if I have the illness? What kind of symptoms do I have? How is this thing transmitted? What are the complications relative to this disease?
So first of all, transmission is from, as Dr. Wright was saying, from person to person. It's mostly from droplets. So if a person sneezes or coughs, then there's droplets that fall on a person, and they can transmit it through that way. And basically, the symptoms are fever, if you have a dry cough, if you have a headache, if you're tired. So it would be similar, you know, to the flu type of thing. The only thing, because it is a type of flu, a virus, the only difference is that this really affects the lungs. So you're going to have shortness of breath. You're going to have very difficulty breathing. And if you have that type of, so it can go from, for example, just kind of shortness of breath, headache, tiredness, that may be a mild case, but then it can go to more of a serious case when you're having shortness of breath, you can't breathe, you can't get breath, you are also perhaps having confusion, inability to really focus, and in that case, then that would be a serious case where you would really then call your physician to find out what to do. When we talk about complications, they are finding that people who are older than 60 and who also have a chronic disease such as cancer, if they have a lower immune system due to cancer treatment or chemotherapy, or if they have diabetes, high blood pressure, or something that is a chronic disease, especially for diabetics, if their blood sugar is not in good control, they are at higher risk of the complications. So they're not higher risk of getting the disease than the general population, but they are higher risk of having the complications, which is having the respiratory problems or the lung problems that I just described.
Okay, and I'm hearing from the news that there may be a certain, I don't know what the word is, incubation period or something, but a certain time where I might not even know that I have the disease, right?
Exactly right.
And when I find out that I have it, or when I find some symptoms, when I notice symptoms, the first thing I need to do is I contact my physician.
Right, exactly. And that's what's so, I guess, something that we really have to caution or make people aware, because I don't think that we have taken it as serious, because, you know, some people may have it and feel fine. The incubation period is about 2 to 14 days, so it can be that you may have been exposed by coughing or touched a surface that was infected, and you may not show any signs or symptoms, but then you go out and you're amongst people, you're talking, you're, you know, hugging, in close contact, and you may, knowingly spread the virus to someone else because you do not have the symptoms or show the signs. And we've seen this with the NBA basketball players. You know, you've seen several of them saying, I didn't feel sick. I didn't have the symptoms. 3 of the Nets, Brooklyn Nets players have been diagnosed, but they say we didn't know. So it's very important that you be aware of the symptoms, as well as, and we'll talk about this a little later, just practicing what we call a new normal, where we're really trying to be aware of ourselves as well as others, not making them at risk.
Okay, perfect. So Dr. Wright, would you help me with this? If I'm noticing the symptoms and I go to my physician, they have me take a test, can the test at one time be negative, later be positive? How, you know, reliable is this? How frequently do I need to get tested? Talk to us about the tests.
Right, so Darlene emphasized the importance of symptoms. We'll come to testing as we elaborate a little bit on symptoms. So symptoms may also vary based on your age. So younger people tend to have less symptoms. Older people may get more severe symptoms. And as she said, you know, it may take 2 days after you're exposed to first develop a symptom. And a lot of people who have symptoms may have a very high fever. So if you're having a fever, that may be all you have, or like she said, a sore throat. When you start feeling sick like that, the first thing you want to do is not run to your doctor or run to the emergency room or run to an urgent care. Because if you're having this infection and you go into a crowded place and you start speaking or sneezing or coughing or touching surfaces with the germ having been on your hand, then those people around you can be exposed. So we want to be aware of this new normal that she talked about. In the past, somebody is sick, they just go to their doctor. If you think you need to go to the emergency room or go to your doctor or you want to call first and say, hey, I think I may have the coronavirus, here's what I'm having, so they can put a plan in place to not have you come in to the room where everybody else is, but they may come to your car, they may take you into a room directly, so we can develop a process that does that. Now, your specific question, can the test be negative? Usually, if you don't have symptoms, and that is usually early, the test is very likely to be negative. But most likely, if you start having symptoms, the test is going to be positive. Or the test could be negative because you had symptoms from the regular flu, or another kind of medical upper respiratory tract illness, so your test is negative. But later, when you're now in the true incubation period, you may now come down with a positive test. So yes, your test can initially be negative because we tested you too early, or you weren't exposed yet, but you had something that looked like the coronavirus infection that we were talking about.
Okay, I think I understand, but I appreciate that emphasis. Don't go immediately to your doctor, call your doctor, and then you'll find out what their protocols are.
Right.
Are there some things that we should be especially concerned about? I mean, for example, am I more likely to get it if I'm on an airplane? Should I cease from my travel? Should I be concerned about being in an airplane?
Right, so the airlines have put out some information that they think it's relatively safe to travel. If you listen to some of the infectious diseases experts, they're saying you may want to put off non-essential travel. And that's because this germ, when I sneeze or I cough or I speak, gets into the air. And it can travel in the air up to about 3 feet from where I am. And then somebody can inhale that air, the droplets in the air, and they can become infected that way. Or I may touch a surface, and they come in after me, touch that same surface, touch their nose, touch their eyes, touch their lips, the mucous membranes, and that germ enters the body. So if one has to travel, then it's recommended that you try to keep your distance. So you may be in the airport and you see people walking around with a mask. Those people may be saying, you know what, I've been feeling sick. I'm going to decrease my chance of these droplets getting into the air to infect others. That's why I'm wearing the mask. When you go to the airport, you want to exercise good hygiene. So you want to wash your hands frequently. Want to not touch your face, want to not touch surfaces. If you have wipes, you can wipe down those surfaces with alcohol wipes or other wipes that can kill this germ. So you decrease the number of germs you're likely to be exposed to. And that way, your chances of infection would be significantly decreased. So yes, traveling in airplanes is sometimes necessary, but we're trying to decrease that as much as possible. When we look at cruise ships, the number of infections are a lot higher on cruise ships than one would expect. And that's, again, because people are touching surfaces, people are close to each other. So most cruise ship operators have now closed their business down because of that, because they recognize the high incidence of infections.
So you mentioned in your answer masks. Is that something that we would be recommending? Should people be wearing masks? How helpful is that? And are there any other, are there medicines that have been developed that can help? Are there, what kinds of things are we encouraged to do from a preventative and a curative point of view, if that exists?
So for when you asked about masks, you should not wear a mask unless you're sick. I mean, they're really encouraging people not to wear masks. It's causing a shortage for those who really need, like the physicians and nurses at the hospital that need the supplies to really serve people who are sick at the hospitals. Sure. So they're asking people not to buy a mask just because you feel, oh, I need this, right? Okay. But when you're talking about really trying to prevent it, as Dr. Wright was talking about, the first number one thing you can do is to wash your hands, just to be very, very careful about washing your hands. Also, when you're coughing, sneezing, to do it within your inter-elbow. And then also one of the things that they recommend is to wipe down surfaces at your home frequently with bacterial, like Clorox. You can use Clorox, or you can use Lysol. There's many things that you can use. If you don't have water, say for example, if you're somewhere at work or somewhere where there's not running water, you can use a hand sanitizer, but you should have, it should have at least 60% of alcohol in the hand sanitizer. So there are ways to prevent it. Also, just being aware that you want to protect yourself, but you also want to protect others. Okay. And so that's very important when we talk about physical distancing.
Is that where we get this social distancing
concept?
Right,
the social distancing. Mm-hmm. And I want to just kind of change that, because people, when we talk about social distancing, they're having kind of difficulty, really saying, well, I want to still be sociable. Mm-hmm. I still want to be able to have times with my friends. So we're talking about physical distancing oneself, and that's staying within 6 feet. That's why we're here on the stage. We're kind of apart, 6 feet, because we want to ensure that we're not up close with one another. But you can have social interaction in different ways, but you don't have to be physically close to people, and that's when they're saying social distancing, that's meaning physically distancing yourself from a person.
Sure, go ahead, please.
Right, so in the past we used to talk about personal space. And so if I'm talking to you, there was a distance that would be comfortable for both you and me to be having that conversation. What we're saying now, because of these health concerns, that social space has increased. We don't need to be that close because we want to decrease the risk of the infection. I wanted to add a little thing as well to the mask. So if you're feeling sick, if you know you're sneezing, runny nose, and you think you have this, and you're going to the doctor, wearing a mask may be helpful then. If you are a professional, I'm managing patients in the hospital, or I'm a dentist, in these times I'm going to be wearing a mask and a face shield, and in addition to washing my hands. So these are adjustments that we have to make. Because of the shortage of masks, for example, hospitals are saying, if we have 5 people with this infection, we're putting them all together. So we can assign a nurse that then can wear 1 mask for the entire 12-hour shift to decrease the use of masks, because we don't have enough. So yeah, mask has its place if we think we are going to be infecting others. But if we're healthy, there's no need to be wearing a mask.
Okay. Back on the social distancing,
right.
You mentioned that this fits in the category of flu, and I don't know the distinctions, but I don't remember in the past, seasons of flu, social distancing, et cetera. What is making this so important, and why is it so urgent? What is making it so necessary that we implement these social distancing practices now?
Because it's just so contagious, and it's just, the way that it has gone from person to person has really just kind of, I think, set a precedence where we are learning things every day. We're looking at China and Iran and Italy and trying to see, some of the things that they're doing. I think I heard the latest figure here that there's 10,000 now cases, right?
Yes, we have 11,639.
Right, and so you can see just within this time frame how contagious it has been, right? And so they're trying to stop this contagion, this virus. And the only way that you can stop it, they really feel that social distancing is one way that you can stop it. So they're really asking people to be very conscious about staying home if you can. If you're going out, to be mindful of going, if you're going out, say for example, you have to go to the grocery store. So you're walking in the grocery store, the first thing you're going to look and see is, you know, how close you are to the person going into the door. Of course, if someone's right on you, you would let them go in first. Then many people, they have wipes now at the grocery store, right? So people normally, and if you watch people, they'll grab the cart, then they'll get the wipe and they'll wipe the cart, but their hand has already touched the cart, right? And so the best thing to do is grab the wipe, then go to the cart, wipe the cart, throw that wipe away, and then wipe your hands with another hand sanitizer, and then go in, right? You can also be very careful not being close, again, to a person when you're on the aisle. So just being mindful. And then, of course, when you get home, you want to wash your hands very carefully, putting things away. The counter that they have been sitting on, you want to wipe that counter down with the disinfectant, as we mentioned before, and just be very, very mindful of some of the items and things that you do.
Okay, Dr. Wright, go ahead.
Right, so this gives us a chance to look at the two approaches to managing this outbreak. There are professionals, researchers, people who are into developing vaccines for this germ, who initially thought that we should just let the disease run its course, meaning don't do all these things we're talking about, because we need the society to get what we call immunity to this germ. So, you know, you get measles, you develop immunity, you shouldn't get it again. But this germ is so new, we're not sure how it's going to behave. And we don't know how many people it will make sick. And if we look at what's happening in other countries, if it gets enough people sick, we won't have the resources in terms of doctors, machines like ventilators, hospital beds, or things like that to take care of the sick people. The projection is that in the United States, we may have 4.8 million people sick, 1.9 million going to the intensive care unit, and 490,000 dying. That's a lot of people. We don't have the resources to manage those people. So we can't adopt that thinking that, okay, this is just like the flu. We know more about the flu. We have a vaccine for the flu. We have medications we can use for the flu. With this germ, we have no vaccines. We have no known medications. We're just trying to use medicines now to see if they work so we can get an understanding. So we don't have enough history on this germ to continue business as usual. And that's why most everyone now in this country is saying we got to take this seriously. We got to change how we're used to behaving.
Okay, I appreciate it. Thanks so much for the responses to those questions. We've received a few questions from our online listeners, and I do want to encourage those who are watching online to feel free to send your questions in. One simple question is, can I have individuals over my house as long as it's under the number 10? Is that permissible? Is that still considered social distancing?
Right, so let me explain my answer this way. I'm a physician. I see 25 patients in my office. Then I go to the store, I encounter some other people, and then I go home. So I don't know what I've been exposed to over those encounters for the day. I touch my car door, I touch the hospital door to get in, I touched surfaces. So I may have this germ. Now, I may not have symptoms right away. It may take 2 days, it may take 10 days. But before I start having symptoms, I can pass the germ on to the people I'm interacting with. So if I have 10 people over or 50 people over, I could still infect people. So the idea is to try to decrease or remove large gatherings as much as possible to try to decrease the risk of this germ spreading. So yeah, you can take your chance, but you're increasing your risk.
Yeah. And I would just say, thank you, Dr. Wright. I would just say, I really wish that we hadn't started with the numbers, 50, 10, because as Dr. Wright said, you could be 2 people and still have the virus. Okay, so it's really not the number, again. It's really being physically distant from one another.
Okay.
So 10 was arbitrarily, I know the president put that number out there. We don't know if that's not a scientific, that was not a logarithm or anything algorithm or anything that they came up with that number. It was just an arbitrary number. Okay. So again, we want to make sure that people don't think that just because I have 5 people over, I'm safe.
Okay, sure. And what about activities? Another question from online that would be more individual. Jogging, biking, walking, are those things still permissible?
Definitely. You want to, that's one of the best ways to kind of get out, get fresh air. It's very important. Take walks, run, walk, whatever you need to do, ride your bike, whatever you can do within keeping yourself healthy. And that's another thing when we talk about prevention. I didn't mention exercise is a good prevention, as well as staying well hydrated, drinking plenty of water, getting plenty of rest. That's very important. And watching the sugar, because sugar does lower your immunity, your immune system. So you really want to watch the sweets. So that's those are other tips to prevent some things from catching this.
Great.
Right. So the recommendations are not to cripple us or put us in a situation where we become totally inactive. The recommendations are for us to be aware of the risk. What are the things that we do that will increase our risk, and to decrease those activities? So if you go to a gym full of people to exercise, that would not necessarily be the wise thing to do at this time. But if you're running by yourself with somebody 6 feet in front or 6 feet behind, that's perfectly fine. So we want people to contextualize what we're talking about here. We understand the risk, droplets, that if you're too close, not washing our hands, not good hygiene with our hand etiquette, touching surfaces, touching our face. I was talking to a colleague of mine, and he said he just couldn't help touching his face. His face is so beautiful. And I said, man, I keep touching my face and I can't say the same thing. So people have just practices that we do that we have to try to get rid of.
I appreciate it. Thank you so much. I don't know if you have any final words to share, anything relative to encouraging, especially individuals in our community who may be thinking this is a drummed up hoax, this is not that deep, this too shall pass. Any final words to encourage us to heed the warning and to take it seriously?
I would just say, just the numbers, if you can see the numbers that have occurred with this virus across the world, that's why they call it a pandemic, because it is global. But I would also encourage people to take this time to really connect with themselves as well as their family in their own home. I mean, this is a time where, even though we're under stress and we're not sure what this virus is going to do or anything, but take advantage of the time. Okay. Know yourself, do some things together with your family in the house, get online, use WhatsApp, connect with others. So I really think it's a good time where we can really take time to rest, relax, and restore ourselves and our families.
Perfect. Dr. Wright.
Right. So I'll say 2 or 3 things. One is, if we look at the natural history of this infection, when we usually say we have 400 cases, we probably have 10 times as many cases. And it takes 2 weeks for us to get a handle on where we were when we say we had 10 cases. So we doubled our number of cases that we diagnosed by testing in the United States yesterday compared to the day before. But we're still going to keep doubling that for the next several days. Young people can protect their parents by not taking this germ home. So even though we think young people think they're invincible, if they don't put themselves in situations where they can expose their parent or grandparent, the chances are that those family members will have less chance of getting exposed to this germ. So I would say that the United States, China reported their first case on December the 8th, 2019. It's thought that it first started on the 17th of November 2019 in China. By the time China closed down their major city on January the 21st, that about 6 weeks later, and thought they had 400 cases, they had at least 1,500, maybe 2,500. And so the diagnosis is always lagging behind the people who are really sick.
Sure.
And so we have to take this seriously.
Okay. Well, no, I appreciate that. I appreciate the urgency to realize this is serious, but also I appreciate the encouragement to take advantage of the time. Right. So we want to thank both of you. We're going to transition into our second segment, which will talk about how people can take advantage of the time. Right. Many individuals have children home from school, so we're going to bring up educators who will talk to us about how to take advantage of this time so that we can make sure we're bonding with our children, but making sure they're not falling behind in school. So thank you so much, Drs. Wright and Drs. Jenkins, and we encourage our online audience to hang with us as we make our quick transition to our educational segment. I want to invite Dr. Summer Wood, who is going to lead out in our educational segment at this time.
Good evening, everyone. We are so glad that you were able to join us this evening. And many of you are at home with children. Unexpectedly, you thought it was going to be a week of spring break, and for some of you, school has been canceled indefinitely for the rest of the year. For others of you, it's been about a 2 or 3 week time period. And you're wondering, what do I do at home with my children? So that is what we're going to be talking about here for this next segment. We have with us Ms. Jackie Kinzer. She is a principal extraordinaire here in the Nashville Public School System. We are so glad to have her here. And I am the principal here at F.H. Jenkins Preparatory School. And she and I are just going to be talking about what do we do? What do you do when you have children at home? And we want to make sure that they still stay active and get some educational experiences as well. So I'm going to ask Ms. Kinzer a couple of questions to start us off. So, how do I manage working at home and ensuring that my kids are getting some type of educational experience at all?
Well, I think about it like this. In years past, when Nashville had lots of snow, we'd have to find something to do in the home. So for parents that are in my age range, if you can remember what you would do academics, but you would also do family games and family time more than the normal day gives us that opportunity. So this is an opportunity to just do a lot of family things. You can go outside in nature. I was glad to hear that it is okay to jog. It's okay to walk outside. So that in itself will help the children to feel better about their situation.
Absolutely. I'm glad you mentioned that because that has been a concern. Are we going to be cooped up in the house all day? And Dr. Wright and Dr. Jenkins helped us to realize it really is about that physical distance. Right. So let's get the kids outside. Let's get them doing some things. I saw today someone who I know who's at home with their children. They were out on a morning walk. You know, so just little things like that can help to break up the monotony of that day. Let's go to the next question. What do you recommend? Should it be open free time, or should parents be looking to try to schedule their kids' days out while they're at home?
Well, first let me say, if your child or your children are having spring break this week, I hope that you're just in preparation for the weeks to come, because spring break should be what it usually is. This is not something that the children brought on, so why should they not get that opportunity to be a little free? But when we start next week, I would say a schedule is better because students have schedules at school. So the more you put that in their mindset that this is really school for now, I think the better outcome it'll be.
Absolutely. So parents, we're really encouraging you, like Ms. Kinzer said, If they're on spring break, please let them have break. I have seen some people, I think, who have kind of lost the idea that it's spring break because it's so non-traditional right now. And they're already thinking about, how do I educate my child at home? And let me put them online, which is okay, you know, a few educational games. We always encourage that. But let them have fun, let them relax. But get that schedule together for next week. Structure is important. Doesn't mean it has to be rigid, but structure is going to really help everybody in this situation.
Now, I also do encourage my parents, any holiday, anytime you have off, even in the summer, to make sure that you allow your children to read daily. It can be from 30 minutes to an hour. It could be independently or as a family, but I do encourage reading even during spring break.
Amen. I am in full agreement with that. Now, we talked about a schedule. Okay, so we know going into this time, when they're typically in school, have a schedule for the children. So should I try to schedule almost 7 hours of time like they're at school? Do I need to pack out the day like they're at school normally?
Absolutely not, because you have to remember at the school setting, we not only teach academics, but we have other periods. We have lunch, we have related arts, which could include PE, art, music, a computer, whatever that school may have, and then you have a period where you meet with your school counselor and your librarian. So that's where the 7 hours come in. So no, I would say no more than 4 hours.
Excellent. So parents, keep that in mind. Do not try to expect to get an entire school day worth of academics out of your student. It's going to be a struggle, and it's going to be probably stressful for both you and the child. So about 4 hours would be a good block. Should I allow my student to work in their rooms or in a space of their choosing when doing schoolwork?
I think if I were in this situation and I still had children at home, I would designate a space. However, if my child has a desktop computer in their bedroom, I would let them do work there, but it would be with expectation. So I think, though, the atmosphere should be a little different. What about if everybody's in a family room where they're all working and you can go to each child if you have multiple children and help them right there?
Excellent. So one thing I also heard you saying is if you have multiple children and you're the parent trying to manage multiple children. So for example, at our school, we will be doing online learning. So the children won't just be at home with parents having to come up with everything for them to do, but there will be like Zoom classes and a few other things that they'll have to do online. So if you have a parent who has multiple children, it's going to be helpful, as you said, maybe we can be in a general space where the parent is able to access the children a little bit more quickly, multitask, exactly, because it's going to be a system of multitasking for sure. Excellent. So how do I limit the screen time? Because I've seen all of these resources that have been posted online, and so many companies are now offering their services for free, which is wonderful, so that our kids can keep getting some learning experiences. But then I also know I've heard about all this research that says kids don't need to be in front of a screen all the time. So how do I limit that and balance it?
I think what I would do is have a schedule. Maybe Mondays, Wednesdays, and Friday might be a little more screen time or vice versa. But I think it's all about being organized. That's why, again, I said I hope parents are making preparations this week. And I'll give a shout out to all the teachers. I think parents are going to really appreciate us because you'll find that this is not an easy task sometimes with the planning and implementing. So I think, though, if you put together a pretty good schedule and your child knows it's for 4 hours, I think you're going to get pretty good results.
Excellent. So can you tell me about some resources that parents might be able to use?
I have a whole lot of resources that I have already sent out, and I hope parents can get them. It would take too long, but I know, for example, for little people, there's the ABC Mouse. They are allowing parents to use this for free for 2 months. So I'm thinking that most of the resources that are out there now, because this is a worldwide situation, that everybody's going to be very eager to offer something because we know that our children still need to be educated, and it's not an easy task, but if we take it slowly, and also one of the best things I would say is talk to your friends. Get on the phone and say, hey, my child's having trouble in algebra. What can I do? Because your son was in algebra last year. So I think communication is going to help too.
So building community is going to be a necessity. Parents, we've got to work together. Our teachers are resources. Our principals are resources. Other parents are resources. Parents, you are, as Ms. Kinzer mentioned, kind of going into some uncharted territory in that now you, in a way, are becoming your child's classroom teacher or facilitator or however you want to look at it. And this may not be something that you have spent a lot of time delving in as it relates to resources and what to do and how to do it. So you're going to need that support network to be able to assist you in helping your child to have a rich educational experience, for sure. So you mentioned ABC Mouse, which I know is targeting specifically for younger children. What are some other ideas that parents could do? I mean, I know we're not going to get an exhaustive list here, but if I'm at home with my child and I want to do something maybe a little bit different, what can I do with my young one? My middle school and high school students, you know, they usually can make it, but I have little people at home. What do I do?
Children learn differently, and smaller children learn by doing. There's many art activities you can do with children that's also a teaching opportunity. If you take that walk with your family, you come back and you do some type of project or you write a story together about it. So with little children, I guess I find that easier than with the older students, because with the older students, they will be doing more screen time. They will be doing more hard copy paperwork. So I think my challenge would be for parents with younger children to just think creatively. Get on the web and see what they can tell you to do. That's another good resource for parents.
Absolutely. So parents who you may say creativity is not my thing, Pinterest. If you go on Pinterest, seriously, you can find so many little activities with materials that you probably already have in your home, right? So if we're still trying to avoid going to stores, and I know a lot of stores have closed, they're not even opening, there are so many activities that you can find on Pinterest that are with household items. I know one thing that our kindergarten teacher does at times, you can get a Ziploc bag, you can put shaving cream in there, and kids can write out, without it being a whole big mess, they can write out their sight words and practice spelling things, and it's just more fun than paper and pencil. So just getting creative and thinking and going online and finding resources like that.
And you can go in your kitchen and get a lot of ideas for math and science. And like you just said about the name writing, you have dried beans. You can help that child who's learning how to write their name. They could write those names out. Then they could be able to touch the letters. And that is also a fun activity. So you've got to make learning fun. That's the key thing. Learning has to be made to be fun.
Absolutely. So parents, you are getting an on-the-job lesson in teaching. You're really going to have to, you're going to figure things out. There will be days where you'll feel like that was the most amazing lesson and activity that I did with my students, with your children. And then there are going to be days where you're like, that bombed. We did not make it through that math lesson very well. Welcome to the life of an educator. It's okay. Don't feel defeated. It is what the challenge is of teaching and learning. But be patient with your children. Be gracious with them. For everyone, this is a new thing. As much as your kids say they look forward to summer break and spring break and Christmas break, they actually really do enjoy being out at school, whether it's just to see their friends, to interact with their teachers, etc. So this is a hard time for them as well, as they're going to be going an extended period of time without being with the people that they're used to being with every single day. So we're going to have to give grace to one another as we are working through this at-home educational experience.
Yeah. One of the most important things to me as an educator is that we not lose sight of social emotional learning. Before you are ready to see success with your students, with your children, while you're being the teacher at home, you must think about their social emotional state. For example, Nashville was hit big with tornadoes. And just as we were getting the students calm about that, this virus has come to hit us now. Just imagine what children are going through. So those of you who do family time or worship time in the morning, what a great time to sit your children down, allow them to ask questions, allow them to share their fears, allow them to say, what's going to happen to me? Because this is very serious. Research will show that children are not going to digest or retain or comprehend when their minds are filled with worldly things like this. So I would suggest before you start on Monday, make sure you have a social emotional period at the beginning so that you can talk to your children about whatever's on their mind. And then you all get together, you pray about it, and all you can do is assure that you're going to do your best as parents to protect them.
Absolutely, absolutely. So you've already gotten something that you know you should put at the beginning of your schedule every day, whether it's a family worship time. We at school we might call it morning meeting or
That's
morning
what we
circle,
call it.
right? Where kids are able to come and just talk and ask questions, express how they feel, and really get that not out of them, but they're able to express it before they start to go into the academic piece. We are just so grateful that you all were able to join us tonight. As we've mentioned, this is uncharted territory for everyone. We are all making adjustments, and we all have to be willing to work together, come together to figure out what we can do from the educational side, what we can do to best serve our children. And so we've got to keep an eye on how are our kids doing? How are we doing? One thing that I think is also very important in our schedule is some quiet time. It's important. Midday, whether it's a nap for really young ones or just time where people are just in their spaces and regrouping and having some moments of quiet, that is okay. You are not neglecting. Sometimes we all need that to get right back into it and do what we need to do for the rest of the day. My final word is to our middle school and high school parents. During this time, your middle school and high schoolers may feel like they have a lot of free time, and many of them have these devices. It is so very important, parents, that you are checking what they are doing on their devices. This is so important. As a principal, I have seen quite a few things as it relates to how students are engaging on social media that parents have no idea. I know sometimes we don't want to seem like big brother, always in the business and this, that, and the other. But with this extended amount of time out of school, there are so many things that they have access to online just from this smartphone. You're going to need to have some type of process where you are able to keep up and stay in check with what they are doing on these phones. I promise you it is going to be so very, very, very important. That is something that, you might have a schedule for how you're checking it. I always tell my parents, don't let them charge their devices in their rooms at night. Have charge in the kitchen, whether it's their laptop, their phones. Because we've had students who come in the morning and they're not ready to learn and we're wondering what's going on. They were up all night on their laptop or on their phone and the parents had no idea. So be very vigilant of this. Because it is for their safety as well. Ms. Kinzer, do you have any final words to close us out and share with us what parents can do?
Yeah, I think that this is an opportunity for more family time. Absolutely. I know I grew up playing games with my sisters and my family, and we still do that, and my children do it because it's something that has been done a lot of times. If you don't feel comfortable to go out to purchase games at this point, you can make up games. You can do fun games. But I tell you, it will also help with the social emotional to pull the family back together.
Absolutely. Thank you. We thank you all for joining us this evening for our Next Steps live question and answer session. Please join us next Thursday evening, same time at 7 p.m. We are going to be talking about finances. We can see the impact that this is having and it is about to have on our economy. And many of you may be affected by this. You may already have a job in which your hours have been cut. You're seeing the financial impact. You're hearing word of a stimulus and everybody getting a check. What does this all mean? What do I do financially? And that is what we're going to be addressing next week. So please, same place, same time. If you have questions, please feel free during our live sessions. You can always ask them, and you can send questions ahead of time to nextsteps@riversidenashville.org. Again, we thank you so much for joining us. We hope you have a wonderful evening. Be healthy, be safe. Take care.